All right, guys, we are moving right along to chapter 25 and renal failure. Think about what the kidneys do, okay? So if the kidneys fail, then less waste is removed out of the blood, more waste stays in the blood, which can be toxic to your central nervous system, your red blood cells, and your platelets. And you're going to have a buildup of toxins or what we call nitrogenous compounds in the blood. So what does that mean? Well, your blood urea nitrogen level is going to go up, okay, and your creatinine level is going to go up. So remember those two values that we talked about in the very beginning. You're also going to see an imbalance of fluid and electrolytes because think about, again, what the kidneys do. They regulate volume. They help to regulate electrolyte levels. They help to regulate acid-base balance. So you might be at risk for acidosis because, again, think about your kidneys are usually regulating via bicarbonate, which is a base. So if they're not working right, then you might consider that you would be at risk for acidosis. And then think about, too, the metabolic functions or the endocrine functions that you see. You might have a decrease in your red blood cell count or your hemoglobin and hematocrit because with the kidneys, or I should say without the kidneys, you're going to have a decrease in erythropoietin, which stimulates red blood cell production, and a decrease of your vitamin D. So your calcium level may actually be decreased. Kidney failure can be acute or chronic. If it's acute, obviously it's sudden onset. And depending on what the cause is, if it's recognized early enough and treated, then usually it's reversible. Again, depending on what it is. Maybe it's because you're taking a certain drug that affects your kidneys. Well, if you realize early enough that you're not going to the bathroom and the doctor realizes that your kidney function is out of order or out of whack, then they'll take you off the medicine and hopefully things will reverse themselves. Chronic, on the other hand, it's just irreversible damage to the kidneys, usually as a result of glomerulonephritis, diabetes, hypertension that has been uncontrolled, things along that line. With acute renal failure, you have an acute shutdown in your kidney function. What do you see with that? Well, think about it. If my kidneys aren't working, then I'm probably going to have a decrease in my urine output, an increase in my BUN and creatinine levels. Okay, so that should make perfect sense from everything we've been talking about. Acute renal failure is divided into three categories based on what causes the failure. You've got pre-renal failure, post-renal failure, and intrinsic renal failure, and you know we're going to talk about all three of them. Let's start with pre-renal failure. This is the most common form of acute renal failure. And basically, if you think about this, pre means above or before the kidney, okay? So your problem is not necessarily the kidney, it's something before the kidney or above or pre the kidney, okay? Most of the time the problem is that there is a decrease in blood flow, okay? So that could be, you have a heart problem that, if I have heart failure where my cardiac output is decreased, well then obviously if I'm not pumping out a lot of blood, my kidneys are not going to get a lot of blood, which will then cause me to have kidney failure. Or maybe I have been in an accident and I've lost blood for some reason. And in that way, I don't have enough blood flow to my kidneys. Again, the problem is not my kidney itself, it's the fact that I'm not getting enough blood flow or volume, maybe. Another thing would be somebody who is severely dehydrated from maybe a terrible GI bug or something. Again, they don't have the fluid volume going to the kidneys. So again, their urine output may be decreased, their BUN and creatinine may be elevated because they're severely dehydrated. Again, the kidney is not the problem, it's the volume or the fluid that they're lacking that causes them to fail. With pre-renal failure, if you have a decrease in renal blood flow, kidney blood flow, then your filtration rate drops. The amount of sodium and other substances that's filtered is reduced. The kidney uses oxygen from available blood that they do get, basically to keep the cells alive rather than do a good amount of work or filtration. So if things are not reversed pretty soon, you might have some ischemic changes, some ischemia. Again, if it's a trauma and you've had acute blood loss or a GI bug, if you replace the blood that's been lost or you give IV fluids, then things will turn around. Somebody who has heart failure, it's probably not going to get a whole lot better. And here's some causes that I put here for you. Heart failure and hypovolemia being the two that should stand out in your mind as the ones making the most sense there. And that's what I would want you to remember. Signs and symptoms, again, remember, a decrease in urine output would be the first thing that you would see, and then an increase in BUN and creatinine levels. Okay, so if pre-renal was a problem before the kidney or above the kidney, then post-renal must be a problem beyond the kidney or after the kidney, post the kidney. And this is usually from an obstruction of urine flow, maybe from a kidney stone. And the obstruction is usually, again, past the kidney, either in the ureter, the bladder, or the urethra. And all you do here in this sense is remove whatever the obstruction is, and things will usually get back to normal. So, again, just think, if I've got a kidney stone down in my ureter, urine's going to back up, eventually affecting my kidney, and can cause my kidney to fail if, something is not done about it. But again, the problem is not necessarily the kidney itself. It's just a problem beyond the kidney that actually affects the function. Last is intrinsic renal failure, or if you want to think intrarenal failure. So remember we said that pre-renal, the problem was before the kidney. Post, the problem was after the kidney. Well, with intrarenal, obviously, the problem is with the kidney itself. There must be some type of structural damage or functional damage, either to the glomerulus, the tubular components, or the interstitial tissue. The most common cause of intrinsic or intrarenal failure is acute tubular necrosis. And this occurs because there has been injury to the tubules by ischemia or a lack of blood flow within the kidney, or certain toxins from different infections or drugs, or different drugs. With acute tubular necrosis, for some reason you've had prolonged renal ischemia or prolonged lack of blood flow, either with sepsis, maybe you've had a major surgery, trauma, burns, hypovolemia. So just think about this. If my patient who will say has heart failure and has a decreased cardiac output, well, initially, I should say, they will have possibly some kidney failure because they have a lack of blood flow. All right, that would be pre-renal. But if it goes on a long period of time and you have that lack of blood flow for so long, or that ischemia for so long, it's going to change from pre-renal failure to intrinsic renal failure, because over the long haul, that ischemia is going to cause necrosis. Exposure to radio contrast dye, heavy metals, nephrotoxic drugs. Lots of people are allergic to the contrast dye that you use for CAT scans, heart caths, things like that, and it can severely damage the kidney itself. Or if you've had a really bad acute pyelonephritis, and most specifically glomerulonephritis, because I said with glomerulonephritis, remember that's that hypersensitivity immune response, and usually you're not going to get better. Your kidney is going to be damaged, and it's going to decrease in function over the long haul, eventually causing tubular necrosis here. The course of acute tubular necrosis, first of all, something initiates the process or causes the tubular injury. Maybe it was because the kidney was exposed to that radioactive dye that the patient might have been allergic to. Then you move into a maintenance phase where your filtration rate falls, waste starts to accumulate in the blood, your urine output decreases or maybe even stops. Hopefully what's going to happen is that you're going to, your body will take over and heal itself and recover so that kidney repair starts, increase in urine output begins, and then slowly your BUN and creatinine levels will get back to normal. Again, it depends on what has caused the necrosis. If it's glomerulonephritis, it may not get better and they may not go into the recovery phase. They may actually move on into chronic renal failure, which is what we're going to talk about next. Chronic renal failure is the end result of conditions that reduce kidney function, diabetes, long-standing hypertension, glomerulonephritis. With this, you move from that acute stage into the chronic renal stage where there is even a greater decrease in your glomerular filtration rate, and you actually have nephrons that are destroyed. And the ones that are left over have to filter more, which causes them to get bigger or hypertrophy, and you have a hyperperfusion or an increase in blood flow through those remaining nephrons. Now, just like any other organ that we've talked about that gets bigger, your kidney, when it hypertrophies, it doesn't work any more effectively. It actually requires more oxygen, and over the long haul, it's not going to help much at all. The different stages of chronic renal failure are listed here for you, and basically you are staged by what your glomerular filtration rate value is, what that level is. And I do want you to know these different stages. Beginning with diminished renal reserve, this is when your GFR drops to 50% normal. Now, your BUN and creatinine may be normal. You may not have any other symptoms, but your filtration rate is 50% of what it should be. Most people can live with this as long as they don't have any other, insult or damage to their kidney that happens. They don't go off and have another CAT scan with some dye or something like that. Again, it depends on what's causing their kidney failure. If it's glomerulonephritis, uncontrolled diabetes, then they may not stay in this stage very long. They're going to progress through the different stages. Renal insufficiency, your glomerular filtration rate is 20 to 50% normal. This is where your kidney cells start to try to compensate a little bit by getting a little bit bigger. You may see a condition called isocynuria, which is when patients have polyuria or a lot of urine output, which doesn't make a whole lot of sense. But during this particular point, they would have a lot of urine output, but the urine has more water in it than it does waste materials. Anemia is very common. Hypertension is very common. Again, the BUN and creatinine may be elevated slightly here. Big thing with renal insufficiency is to have good diabetes and blood pressure control. Watch what drugs you prescribe, specifically antibiotics. And they need to be on a low-protein diet because, again, the kidneys are supposed to excrete that end product of protein. And if they're not working right, they're damaged. You don't want to be filling your body full of a lot of protein that your kidneys are trying to get rid of. You move into renal failure when your GFR is 5% to 20% normal. Your kidneys here are no longer able to regulate the volume or the electrolytes appropriately. You may see a high potassium. You're at risk for metabolic acidosis. Usually these people are swollen or have edema. And then just signs and symptoms of uremia in the blood. You basically have urine and waste products in the blood, which will affect their central nervous system. They may be confused because basically they have toxins in their blood instead of being excreted out of their urine. End-stage renal disease is when your GFR is less than 5%. This is not good here. You have a reduction in your renal capillaries. There's scarring, atrophy, and fibrosis of your tubules. Frank signs of uremia or urine in the blood. Very confused, usually. And these people will not live unless they have dialysis or a transplant. Dialysis is where they go in so many times a week and hook up to a machine that actually filters their blood manually and works like a kidney to get the toxins out. Signs and symptoms of chronic renal failure. Well, think about what the kidneys do, and you can understand what you would see here. You have a buildup of waste in the body. You're going to have electrolyte fluid imbalances, acid-base imbalances, mineral and bone disorders, bleeding disorders, cardiovascular disorders, GI disorders, and your neural function, central nervous system function is going to be affected as well. So I would urge you to look that up in your book so you can see the different manifestations that you would see. Very common to have a high potassium level. Acidosis is very common. A low calcium level is very common. Hypertension, heart failure, anorexia, nausea, vomiting, things of that nature. They may have a disorder in skin integrity. They seem to itch a lot. That's very common. Their immune function goes down, again, because of this chronic disorder, sexual dysfunction, and then obviously they're going to have problems eliminating any type of drug that they get. So it's very common for your patients who have end-stage renal disease to only take drugs maybe every 48 hours instead of every day. Again, it depends on how the drug is excreted. Treatment, diet management is very important. Low protein, low potassium, low sodium, fluid in moderation. A lot of these people will be on fluid restrictions. Dialysis, again, if they're end-stage renal, they'll have to be on dialysis or have a kidney transplant to be able to survive.